requires more information, you can reach out to me. Mr. Madhu, I just ran through as fast as possible so that Palka gets a lot of time to respond.
Yeah. Thank you very much. You are brief and you had explained the salient features of your app. Definitely, I hope it will be interesting for the participants and they'll revert back. Mr. Bhaskaran, I request you in the chat box to leave your mail ID and other details.
Yeah, okay.
Okay, thank you. Now, introduction of today's speaker, Mr. Palka Bhasin Kapoor. She is a clinical psychologist practicing over 17 years. Reach, assist, and care is the philosophy that Ms. Palka abides by. She believes in providing solutions to people's psychological problems with utmost dedication. She helps individuals adapt all the events and situations in their life in a socially acceptable way. A certified lifestyle management expert holding a postgraduate degree in preventive and promotive healthcare from Apollo Hospitals Educational and Research Foundation. A master hypnotist from California University, USA. A certified art therapist from IBHAS, New Delhi. A certified didactic and hands-on training on basic life support by the American Heart Association, which is the Fortis Hospital. Special educator in learning disability, lifestyle management expert, nutritional advisor on integrative dietetic and holistic health accredited by the ISMN, hypnotherapist from the California University, USA, certified art therapist from IBHAS, New Delhi. So there are various areas of her specialty, which is stress management, anxiety, depression, body dysmorphia, relation and couple counseling, self-esteem, health-related issues, autoimmune disorders, UTI, PCOD, PCOS, thyroid due to stress, stress and anxiety due to high-risk pregnancy and issues like the IVF, pre- and post-partum anxiety and depression, high blood pressure-related issues during pregnancy and premature baby pregnancy less than 31 weeks, anxiety, stress, and depression due to miscarriage or infant-related health issues like Fragile X syndrome, Down syndrome, chromosome 21. So she has been an active participating member of the CBSE National Adolescence Education Program under the Ministry of Home Resource Development, Government of India, the National Progressive Schools Conference, NPSC, in technical collaboration with Expressions India. With these few words, I take pleasure in introducing Ms. Palka Bhasin Kapoor. Ma'am, the floor is yours. Now you can just talk.
Thank you. Thank you so much for the beautiful introduction. And it's a privilege to be invited and speaking on this esteemed platform. I am grateful to Rotary Club of Visakhapatnam and Mr. B. Madhu to reach out to me on Dumpito, our mental health and holistic well-being platform. Mental health is an extremely sensitive yet very important topic. I want to share one line with all of you before I begin. It's from one of my clients. With tears in her eyes, my client said, "Ma'am, if only my mind could talk." It touched my heart. And if only our minds could talk and be heard, so many problems and issues could be addressed. And from here, I'd like to take on our PPT presentation, which I'm going to be presenting to all of you today. Okay, so it's on mental health. And what is mental health? Like we all have a physical body, we all have a physical health for which we go to the doctor, a physician. Like that, we have a mental health because we all have a mind. And what does mental health comprise is of? It's our thoughts, feelings, and behaviors. So what we usually see in mental health is behavior, somebody being very aggressive, crying, or having mental breakdowns, getting disturbed, being anxious. So these are the behaviors. But mental health is all three of us, all three of it: thoughts, feelings, and behavior. And whenever there's an error in the thought process due to different situations and circumstances which we are unable to process, our behavior gets affected. So let's know about all of it and more today. What are, mental health is something that cannot be seen, it can only be felt. Today I might be looking very good, I might be dressed very well, but I may be very disturbed from inside. So it cannot be seen, it can be only felt. I may be angry, but it cannot be seen, it can be only felt because the anger is within me. So that is mental health. And when we are not in a good mental health or a state of mind, this is what happens to our mind. It's all jumbled. Let's come to one of some of the common mental health concerns that whenever I meet my clients or people come to me, I ask them, what are your present concerns? Why have you come? Why are you reaching out to a psychologist? So, some of the very common mental health concerns, which may seem very small, but no, they are not small. They need to be addressed, because if they are not addressed right time, then they can lead to very big consequences later in the future, not only for yourself, but for your family members, your near and dear ones, and even for yourself. So let's get into the common mental health concerns. It says loud noises disturb me. My overthinking starts. Loud noises से stress होता है. My work gets affected. Now see over here, it might look very small. अरे loud voice ही तो है. But no, it's like a trigger for this person. Any loud voice can become a stress and a trigger. Like for example, a horn of a truck, or if there is something is happening in a temple, or there's a speaker, if there is a marriage happening, eh, or if the pressure cooker goes off, it causes anxiety and stress, and the overthinking happens, and the work starts to get affected. You're not able to concentrate on your work, you don't know what is happening, but something is triggering. Or when somebody talks loudly to you, when somebody gets angry, when somebody is shouting at you, it gets very overwhelming, you can't take it. So this needs to be addressed. Let's look at some other common health concerns, mental health concerns. Loss of job. People have this constant fear, I'm not good enough. Imposter syndrome, I'll lose my job. What if I lose my job? What will happen? Overthinking. They start, these things may be interconnected, may not be interconnected, but these are common problems. They feel the work environment is very toxic. They can't function properly in the work environment. They feel overwhelmed when they are going for work. Every morning, it's a struggle for them to get up and leave for office because they fear the office environment, or a dominating boss, or the behavior of other people. Or it could be that you judge yourself, you feel I'm not good enough, I can't work, I can't take responsibilities. You may start feeling suicidal, self harm thoughts. At the same time, you may have trouble in your married life. You feel that neither can I handle my job nor my married life. And you may start having thoughts of self harm or ending this pain in different ways. Again, I'm not good enough. When I talk to people, why do you are not good enough, they say, no, we are not good enough, we are less. Why are you less? Because mostly people say we are introverts, we talk less, we express less. We are not expressive, we don't socially, we can't get along with other people. Other people are very chirpy, they make friends very quickly, they are extroverts. So they have the social anxiety, and they start judging themselves, or people tell them, अरे तुम तो बहुत कम बात करते हो, तुम तो मुस्कुराते नहीं हो, you don't say much. So you continuously think in your head, is there something wrong with me? You always doubt your relationship. This is one sided relationship. Either you feel you're giving more, or you feel that you're getting less. It could be anything. And we start, all this starts, or all this could be a reason because of poor communication skills. We feel we can't communicate. I don't know what to say. I don't know how to say. I become passive at times. I'm quiet most of the times, or I'm very loud most of the times. I come across very, very aggressive. So, your communication skills may be a problem for you, from where your mental health issues start. There's a lot of confusion that always happens. I can't make decisions. There is anxiety. Or sometimes when you're sitting all by yourself, you might go in the past. Things should have been this way. I should have done this. Others should have done this for me. This particular task should have been done this way. Or going too much in the future. I must work a lot to have a secure future. Or what if my health becomes bad? Or what if my child becomes unwell? What if I lose a job? What if my wife leaves me and go? And so many thoughts which are completely irrational. You don't have any basis, you can't prove them, they consistently go on and on in your mind 24/7. Breakdowns, because in today's time where there is so much there's so much stimulus from every place, so much information coming from every place, we are not able to handle our behavior, right? So there is so much stimulus that breakdowns are happening. Extreme breakdowns, we are crying 1 minute, we are very happy 1 minute. Extreme things are happening, we are very sad, we are very low. And then what are we doing? We are eating most of the time to make us feel better. Cry easily when you get anxious for whatever little trigger or a big trigger, when you can't manage situations. There may be breathing issues, panic attack, palpitation of the heart, constant headaches, constant overthinking, negative thinking, intrusive thinking, repetitive thinking become a part of your everyday life. And you start feeling that this is the way of living. This is how we are supposed to live. Stressful life, overburdening life. Sometimes people also go on medication. They feel that medication is going to help them, or for a short period of time, medication also helps. Then what after that? So it's very important to address these issues. These issues need to be addressed in a non judgmental, neutral environment by a third person who does not judge you. Maybe work related anxiety. A lot of men and women have work related anxiety, that they switch jobs or they switch cities, and then they feel uncomfortable and overwhelmed. They start doubting their decisions about everything in life. Are we doing right? Are we wrong? Sometimes they can't even make decisions and they stay in a suspension mode because you don't know how to make decisions, or you fear the outcome of the decisions. So there is a lot of work related anxiety, and with work related anxiety, lot of toxic environment, narcissistic bosses, overwhelming bosses, or colleagues also play a very important role. How to manage those things, because they are not in our control. I used to be a very happy go lucky person, but now I'm not. I don't know, something has happened in my life. There is constant sadness and worry. I have everything in life. I'm doing good. It's a good pay package. Our health is going good. We have bought our own apartment. We are paying our EMIs. We go for vacations. Our children are doing well. Our parents are well settled. But there's a constant worry and sadness. What if something happens and all this falls? What if something happens? So there's this constant struggle of what if. Low energy levels since last 7 months. I'm unable to get up in the morning. When I get up in the morning, I feel lethargic and tired. I feel as if I've not slept only. You know, so I'm tired all the time, and thus I feel nervous all the time. Also, sleep related. A lot of people are coming to me with the with technology being used so much, and so many things have opened up. Sleep is something that over a period of time, people find it hard to fall asleep. They are not getting the quality and quantity of sleep that is required for their well being. It could be because of your lifestyle, or it could be because of your thought process, that there's an error in your thought process, there is anxiety, there is constant overthinking, and thus I wake up in my sleep like a shock, or I sleep for 2 hours and suddenly my sleep breaks. I don't know. It is difficult for me to fall asleep. Or as the day is ending and the sun goes down, I start having a fear. Will I fall asleep today or will I be awake today? I'm unable to take decisions whether I should go for a love marriage or an arranged marriage. I'm already 35 years old. What should I do in my life? So, what happens is over a period of time, your body starts getting affected with so much of stress, anxiety, and overthinking. Maybe you feel a pain in your arm. Maybe there are sensations around your rectum area, UTI, PCOD, PCOS, thyroid. These are all lifestyle related issues arising out of stress. You may feel झंझनाहट, जैसे टांगों में झंझनाहट हो रही है, या you're sweating. So these are all psychosomatic symptoms. If you usually go for a test, everything is fine and normal. So the doctor, when you usually refer your doctor, your physician, they say that sleep well, rest, and go for stress management. Manage your stress, de-stress, practice mindfulness. But how to do that? How to do that? And on top of that, we often hear people telling, oh, this is life. Life to aise hi chalti hai. This all is a part of life. Utar chadhav. No, life is beautiful. And it has to be led in a manner in which you enjoy life. जो आप enjoy करना चाहते हैं, जिसमें आपको खुशी मिले और आपके near and dear ones को भी खुशी मिले. Relationship issues, a lot of conflict between partners, a lot of conflicts, not because there's a problem between partners, because we are not able to communicate what we feel. And what we do, we minimize the things, put it under the carpet, not address it at the right moment, because we feel लड़ाई हो जाएगी, ऊंची आवाज होगी, हाउस एनवायरनमेंट भी डिस्टर्ब होगा, बच्चे हैं तो वो डिस्टर्ब होंगे, ओल्ड पेरेंट्स हैं तो परेशान हो जाएंगे. So what we don't address issues over a period of time. Our relationship issues, we don't address. And then one day we feel that there are so many issues that we can't talk about it. It's very important, friends, to address right issues at the right time. Don't minimize issues. Don't minimize issues that we will deal later. Sometimes it becomes too late to deal with issues later on. Anger issues. Either we become, there are two types of anger. One is aggressive anger and one is passive anger. Anger management is very important in today's time. Why are children throwing tantrums or getting very aggressive? Because they see adults around themselves shouting, screaming, banging doors. They don't know how to handle themselves, abusing, being physical. So that's what they are learning from their environment. We need to learn coping management and strategies, how to manage our behavior. अगर गुस्सा आया है, it needs to be expressed in the appropriate manner, in a healthy manner, not in an unhealthy manner for yourself and for people around you and your environment. Poor communication skills. Over a period of time, what happens when we start keeping things within ourselves, not discussing? Of course, our communication skills become poor. We don't know how to talk, what to talk, and sometimes we judge ourselves. We do comparison with others. Others are so confident, they are speaking so well, they are extroverts, they know how to manage, they are street smart. We are not. Again, imposter syndrome. They create this spiral around themselves, which is created by their environment, which is created through their thought process, and it leads to bigger problems. Sometimes relationship problems, that I don't have a normal relationship with my father, or I come from a dysfunctional family. Will I be a good father to my child? Will my child have the same relationship with me? How do I work? So there are so many apprehensions that you want to communicate, you want to talk. So it's very important that these issues are addressed. Trauma, family trauma, relationship traumas need to be addressed so that it does not go to the next generation. That not enjoying life. Like I said, when there is no happiness and when you feel this is life, getting up in the morning, following a routine, not able to express yourself, obviously there will be no enjoyment. There will be short enjoyments. Going out for a dinner, coming back, again feeling sad. Shopping therapy, okay, it makes you happy for some time. Online shopping, receiving an online, parcel, short-lived happiness. It is not a long-term happiness. Social anxiety or socially not able to manage yourself. Now, this happens with a lot of high achieving people and students and individuals. I come across a lot of students who are brilliant and even adults who are doing brilliantly in their life. Probably they've cracked the UPSC or a CA, or they're doing medical, or they're going to become doctors, and they have cracked through the medical colleges, government colleges, and they're extremely intelligent. But post going there, or post taking up a job that is demanding, or post going into a career that is demanding, they are unable to balance their emotions and behavior. They are unable to sustain, so they feel we are not fit, I should not become a CA, or I should leave my, they have so much of anxiety, they leave their the course that they are studying for in between if they're unable to crack an MBA, or after cracking a CAT exam they feel lost. They're unable to cope with their stress, they're unable to cope with their feelings of pressure, so staying away from home becomes difficult for them. Of course, you need to prepare yourself for college and hostel life. You feel like quitting most of the times. This affects your eating pattern. Acidity is there, gas, bloating, constipation, gut health issues start happening, and our gut health and our mental health are related to each other. So it's very important that we address these issues suddenly from being having such a powerful goal and aim. And even after achieving it, suddenly you seem aimless. You don't know what to do. You're clueless. Apart from the issues that I just shared with you, our platform Dumpito comes with a lot of other issues that people mail, write in, or fill in their forms when they come to us. That what are their counseling needs apart from the some common mental health issues that I spoke about. उनके अलावा भी बहुत सारे issues हैं, जैसे rebuilding trust. अगर आपका ट्रस्ट टूट जाता है जॉब में बॉस के साथ हुआ या फैमिली मेंबर्स के साथ, हाउ टू रीबिल्ड ट्रस्ट, एंड इट्स इजी, बट व्हाट वी डू, हम उसको पकड़ के भी बैठ जाते हैं. आई कैन नेवर बिल्ड माई ट्रस्ट वाज ब्रोकन, आई एम shattered. So the way you think is the way you feel, is the way you behave. So thought process is very important. Everything can be rebuilt, and there is no problem that cannot be solved. It could be an emotional problem, it could be a physical problem, it could be, for your social well-being, but you need to address the problem at the right place where you are going to be heard in a neutral manner, in a confidential manner. And our platform Dumpito has all these qualities: to get married or not to get married, facing marital issues, build lack of self-esteem, I want to build my confidence, I have anger management issues, especially in the age group of 18 to 25, and also in the age group post retirement, 68, 70, or 55. A lot of anger management issues are there in both men and women. Conflict resolution, my partner does not know I'm seeking help, so being emotionally available for your partner. So these are issues that need to be addressed, which we feel it's okay, ऐसे ही होता है, लाइफ निकल जाएगी, अरे ये तो कोई बात नहीं, जैसे जैसे बच्चे बड़े होंगे ना वैसे वैसे सब ठीक हो जाएगा. No, these need to be addressed because every day you need to make it count for your well-being, for yourself and people around you. Sometimes adults or clients also consult us from that our parents are having a lot of problems. There's a lot of problems between our parents, they can't get along, due to which the family environment is suffering. So and the children are feeling trauma, how to deal with parents. And it can be parents who are 55 years or 60 plus, They also have a lot of issues, which again goes from one generation to another. It is difficult for the children to understand. All these issues are and can be addressed. Of course, apart from that, there's anxiety, stress, depression. They may be clinical issues where there are actually clinical diagnoses that need to be made, either through seeing the symptoms and diagnosis or through testing. Again, abusive childhood that still plays an important part in your adulthood, due to which you suffer from a lot of other issues like borderline personality issues, narcissism, being toxic to yourself or others, parents having issue, family therapy, and again anger management, building confidence, and getting a direction for yourself in life. All these issues are mental health related queries which need to be addressed. Now I'll come to very simple. These are not simple, I would not say simple, but people feel these are simple. I can't sleep at night. I fear that I will not be able to sleep at night. These are two different issues and they need to be addressed. You can't sleep at night. There must be a reason why you can't sleep at night. And it must be very valid that your sleep is not happening. I get nervous very quickly. What is the reason for you to get nervous? What happens? You get nervous, you stop meeting people, you stop socializing, you cut yourself, you feel you're an introvert, you get into a loop. I can't do anything right. I can't make food. I can't take decisions. This is very difficult for me. So you start cutting off things from your life, or you feel you're not good enough. I need to prove myself. I need to prove myself. I'm a housewife, I'm a stay at home mother. I need to prove myself to my in laws. My children need to do good. I need to prove myself. No, you don't need to prove yourself. Your children will do good for themselves. आपको नहीं करने की जरूरत है. Again, overthinking, stress. I need to compensate for things that I have done for others are providing me. This happens most of the time with women who give majority of their life in bringing up a family, looking after family, in-laws, husband, leaving their work. They feel that everything, or people make them feel कि तुमको कितना मिला है, अब तुमको compensate करना है. You have to be there on every social occasion. You have to do this. And it is difficult for them sometimes. I can't say no. This is one of the things that people come up that unse no nahi bola jata. And because they can't say no, they're always overworked. They have a pressure in them to do something. They're always on their toes. So these were some of the common issues that are mental health issues. They need to be addressed. If you are having them, or if you know someone in your house is going through them, let them know help is available. There is a help. There are professionals who can tackle these issues in a professional manner. Now, out of anxiety, a lot of lifestyle related, health related issues are arising, not only in women, in men also, like PCOD, PCOS, autoimmune disorder, urinary tract infection, blood pressure. These are all coming out of anxiety. They may be real health issues, but most of the time in today's time, one common thing in all of them is anxiety. It has to do with your mental well-being. You take medication for 5 days, the symptoms reduce, you start feeling better, but again it happens to you. Again, you're revisiting the doctor, especially in women. Again, you're revisiting the doctor. So usually what the doctor says, there is no specific diagnosis. They see your symptoms or you tell how you're feeling, because there is no diagnosis of this. Symptom varies from individuals to individuals because of various reasons. Of course, because of emotions, because everybody has a different reason. So symptoms vary. Low stress and low immunity. Because your cortisol level, that is the stress hormone, is always right, upright. It is always on the increase. You're operating from a fear and a flight mode. अभी कुछ उठ के हो जाएगा, मुझे भागना पड़ेगा. अभी मेरे ऊपर कोई बॉम्ब फूटेगा. अभी अब मेरे हस्बैंड घर आएंगे घर पे and it goes. अभी बच्चे कुछ बोल देंगे. और it could be opposite also. That अभी मैंने कुछ बोला और बॉम्ब फूट गया. So you're always in a fear and a flight mode. My boss is not in a good mood. Should I go and ask him for a holiday? Or should I share this with my boss? Or, if you're young and you entered into a new organization, should I put up this query? What will people think? I'm a fool. I don't understand these simple things. So the cortisol level of the body is already high. That is the stress hormone. And we are always in a fight, in a flight mode. So we are operating out of that zone. Stress levels are always high. Lack of vitamins and minerals. Over here, I would like to reinforce food is not vitamins and minerals. Food that we eat, roti, chapati, dal, rasam, dal, saag, kheer, halwa, it's not vitamins and minerals. That is food. We need to focus on our vitamins and minerals like vitamin D3, B12, and other essential amino acids and our protein levels to combat our anxiety and mental health issues. And only a professional will be able to guide you on this. Of course, lifestyle, there is no sleeping pattern, there is no eating pattern, you're all over the place, maybe binge eating, stress eating, junk eating, and of course there is anxiety and overthinking that is constantly happening. Now, how can we deal with all this? How can we deal all this? ये तो हो रहा है. Over here, therapy plays a very, very important role. And at Dumpito, what we do is we psychoeducate and we make our clients enable to help themselves. We equip them with coping mechanisms and techniques how to manage themselves in a stressful situation, whether it's anger, whether it's dealing with your boss, whether it's relationship, whether it's something that is out of your control, how to deal with it. So what does therapy usually do? Therapy helps you to differentiate between rational and irrational thoughts. So there are two kind of thoughts, the rational and irrational. And over a period of time, we become irrational, not because we want to be, because of our situations and circumstances in our life, we start becoming irrational in our thoughts, and thus we start operating out of the fear and the flight mode, and thus the anxiety. Differentiate between fear and danger, what is real and what is not real. So usually what happens when we are stressed, we operate out of fear. So we don't know what we are saying is right or wrong. Is it really true or is it just our imagination? Work on things that I can control versus I can't control. And this beautiful circle over here, I share with all my clients. See, in life, there are things you can control and things you can't control. Unfortunately, 99.9% because of our social conditioning, our environment, we are on the outer circle. And this outer circle causes us overthinking, anxiety, stress, behavioral issues, um, lifestyle related issues, because this is not in our control and we want to control. Either we want to control or we get controlled by it. Like how others feel, how others behave, how others react, if others forgive me, other people's boundaries, the past, the future, the beliefs, perception of others, the attitude of others, what happens around me, what others say, what others think of me. We cannot control this, and neither we know what is going to happen. I will give you a small example. Go to the office, boss is in a very good mood. Well done, good job, everybody is very good. After 2 hours, you go, he's in a nasty mood. And you start doubt yourself. What happened? Did I do something wrong? Did I mail him on time? Was my work okay? Why is he behaving like this? Is there something wrong with me? Have I done something? You don't know because it's the outer circle. It will keep on changing. Another very common example, you make food for your family with love and affection. You spend hours in the kitchen. And then suddenly the child is not eating. You start thinking, is my namak theek hai? Is it well cooked? I wish I would have made something else. The child is not eating. I don't know if my husband would like it or not. It's the outer circle. You can't control. But what you can control is the inner circle, and that is what therapy psychoeducates you and enables you. Focus on the inner circle. When you focus on the inner circle, you are much more in control. Of course, focus on sleep hygiene, the circadian rhythm, very, very important. Focus on a biological clock. When we are stressed, our biological sleeping clock goes out of toss, which the therapist helps you to get back in place. Having a neutral perspective in life. Usually we have very extremes behavior. Either we are aggressive or passive. Either we are sad or we are happy. Extreme. There is something known as a neutral perspective. And when we learn or therapy helps us to gain this neutral perspective, most of the things in our life, whether it are situations or circumstances, we are able to deal in a better manner. Lifestyle modifications, that is mood and food, going for a walk, and working on our lifestyle also is a part where therapy can help you. There are different types of therapy, and usually people are not aware of it. When they feel that they're talking to a counselor or they're going to a counselor or meeting a therapist, they feel ये लोग बातें करेंगे, ये बात करते हैं, they just talk. But let me tell you, there are different kinds of therapy. That is CBT, that is cognitive behavioral therapy. REBT, that is rational emotive behavioral therapy. Art therapy, where you express through expression of art based. It's nothing to do with your creativity. It's a therapy which helps you to release emotions and feelings. An eclectic approach, maybe the best of all therapies can be used depending on the diagnosis or need of the client. Hypnotherapy, again focusing on the conscious and the subconscious mind, that why are certain patterns recurrently happening in your life, like trauma, childhood trauma, abuse, or it could be anything else. It could be anxiety, overthinking, focus solution therapy, need-based therapy, transactional analysis therapy. So through talk therapy, the tools that are shared with you, the coping mechanisms that are shared with you are based on these therapy, is just not talking, venting, and catharsis. That is a part of therapy, but a lot of other things also happen in a therapy, and you can actually, you can actually see your progress in therapy from where you started and where you are today. You can see the progress. Either you can number it or you can see the degree in which you have transformed your life. So this therapy that we do at Dumpito, we can actually quantify it. It is there for you to feel and see for yourself. Why therapy at Dumpito? So let me tell you that when you're going for therapy, or when you feel you need therapy, or when you feel somebody else need therapy, it's very, very important to know certain aspects before going to therapy, or before going to a therapist, or to select your therapist. So at Dumpito, the most essential things that we follow for therapy are confidentiality. It is an extremely confidential platform. There is no recording, there is no videos that we make. There is absolutely confidentiality that is shared between the therapist and the client. We do not share that with any of your friends or your family members or with anyone else. Non-judgmental, we don't judge you. You can share anything with us, whether it is your sexuality, whether you are he, she, or any other pronoun. We accept you the way you are. You can share anything that you have done or that has happened to you. We do not judge you from where you're coming from. There is total acceptance. It is a safe and a neutral environment. The therapist is a neutral person who is not judging you, and the environment is extremely safe and confidential. We don't give suggestions or make decisions for you. Over here, we equip you to make your own decisions. Therapy is a process that helps you to make independent and ably moving ahead in life, not being dependent on your therapist. So we don't make suggestions for you or decisions. We help you in your decision making skills. There are professionally qualified individuals, at least with a master's degree in psychology. So all our psychologists over here are professionally qualified individuals. Leads to a correct diagnosis. Like I said, either if testing is required, like if you go to a doctor and if you're having fever for more than 3 to 5 days, he tells you to do a blood test. Similarly, if there is a clinical issue, a clinical diagnosis, a clinical depression or schizophrenia or clinical, then we do testing for you, a psychometric psychoanalysis testing, which gives you the correct diagnosis. We focus on solution oriented, result focused solutions. And like I said, psychoeducation, which is very, very close to my heart. I always make sure that I psychoeducate my clients, just not talk to them venting and catharsis. I make sure I share the tools with them, their thought process from irrational to rational, so that they start feeling at ease with themselves and others around themselves. So, psychoeducation is an extremely important part of therapy. We introduce you to your feelings, thoughts, and emotions, to accept certain things in your life. It's very important for yourself to accept those feelings, whether they're negative feelings, whether they're irrational feelings, whether they're harsh feelings, to accept. Also, along with psychoeducation, the 10th point is like an eighth are very relevant: use of upper and lower brain management in stressful situations. Now, what happens usually, 99.9 people are only using the lower brain. For example, this is our brain, this is the lower brain, and this is the upper brain. So usually we only focus on problems. ये मुझसे बात नहीं कर रहा, पानी गिर गया, बारिश आ गई, घर गंदा हो गया, बच्चा रो रहा है, आप केमिस्ट से दवाई नहीं आई, बत्ती चली गई, बॉस इज नॉट गुड, जॉब इज नॉट वेल पेइंग. वी ओनली फोकस ओनली ऑन प्रॉब्लम्स. अगर मैं कॉल करूंगी तो मुझे कोई वापस रिस्पॉन्ड करेगा या नहीं करेगा. माई मैसेजेस आर नेवर रिस्पॉन्डेड टू. वी आर ओनली फोकसिंग ऑन प्रॉब्लम्स because we have been conditioned to, or we have seen in our around our surroundings, people only focusing on problems now, people only doing that and then talking about it again and again and again. But we psychoeducate our clients to use the upper brain, management, coping, managing, solution oriented. So the use of lower and upper brain, and how to activate parts of your upper brain, how to know when there's a trigger in the lower brain, how to reduce that trigger and let the upper brain take over. Also, very, very important in today's time, we teach our clients through therapy self-care, self-love, and awareness. Self-care is not being selfish. Self-care is very, very important in today's time. You have to learn the ways of loving and accepting yourself with your with your good and your bad. We all are fallible human beings. Nobody is perfect, but how to still love ourselves and others also. What therapy is not. So there are a lot of myths and there are a lot of misconceptions about therapy. So what is therapy not? It is not a waste of time. It is an investment of time and money, and it gives you long-term benefits. It will not give you short-term benefit. It will give you long-term benefit. So it is not a waste of time. It is not a waste of money. It is an investment. अगर आज आप थेरेपी में नहीं इन्वेस्ट करेंगे तो कल ये प्रॉब्लम्स बहुत बढ़ जाएंगी, and maybe it will be very difficult for you to come out of it, or your loved ones, or people who are going through different problems in life. So it's very important to seek out for help which is available at the right time, at the right place. So this is not a waste of time and money. This is an investment in your well-being, well-being of your loved ones. It's beyond talking, venting, and catharsis. Yes, it is beyond talking, venting, because you can talk to anybody. You can talk to your relatives at home. You can talk to your friends. You can talk to your colleagues. But over here, we equip you with strategies and coping mechanisms. And it's therapy is not like speaking to your friends and relatives, because we don't judge you, and the environment over here is confidential and neutral. So it's easy for you to come out with your feelings. We do not focus on the past experiences or belief system, because past experiences and belief systems is the outer circle, which I just showed you in the previous slide. That will keep on changing. We focus on the present, what you can do in the present, because neither we can see the future, can't mind read, nor we can go back in the past and change the events in our life. So
Ma'am, time is up.
yeah, so I will just quickly share some of the reviews of people, and let me tell you, this platform has come out of a lot of love and compassion. Over more than, it has experience of, I have 17 years of work experience, but a lot of experiences of other people are there. But the name and the physical form has come now in the past 2-3 years, but we have been working in this field for a very long time, and these are some of the reviews that I want to share with you. I just wanted to share some good news with you. I have got a great salary hike and my current job and you taught me a lot about gratitude and giving myself a pat on my back. So this is what therapy does. Can you see the feelings? Can you see the emotions? I'm extremely overjoyed at how different I feel, how different you start feeling about yourself, and not to judge yourself and others. And this is something very close to me. This was a very close case. And I just want to read out few of the details that I still remember. At I still remember that at the first shot, I dialed the wrong number, and the driver in the rickshaw actually tried to comfort me as I did not know that I was crying. When the phone rang on the other side, there was such a comforting and encouraging words that I was assured that I had tapped the right source for help. Palka, I'm grateful to you for helping my son realize his shortcoming. Even today, many people are not comfortable for counseling because they think it is meant for mad people. But they fail to realize that is just as we go to a physician for a physical health, we need to go to a psychologist for mental health. The suicidal tendency does not exist anymore. This is one book which is available on our platform, which I recommend to all my viewers and my clients. If you want to help yourself or someone or know more about mental health, this is a highly recommended book, easy to understand, easy and simple language. And at Dumpito, we are kind and compassionate to help you find hope and peace when your own mind tells you there isn't any. Let's help you to tune into your own wisdom through therapy. And therapy and help is available for anything. It may be small, it may be big, it needs to be addressed, and help is available. Thank you, and for being a part of this presentation. And if there are any questions, I'd like to address them. I can't hear you.
I think she is
Many people
muted.
will wonder, they will hold back, like from getting a consulting, going to a psychiatrist and all. Is it expensive for them to do this?
So see, mental health, uh, I would not say expensive. Physical health is even as expensive. Like you go to a doctor,
Okay.
and the doctor may spend just 10 minutes with you, and he's charging me an X amount of, money. You have a 50-minute session. A therapy session is for 50 minutes, not for 5 minutes or 10 minutes. And
Yeah.
and the therapist talks to you. So it's an investment that you're making. And no, in today's time, it is not expensive. Like I said, it is an investment. If you don't do it right now, it may have a consequence that will be very difficult for you or your loved ones to deal with it later. So it is an investment in you. And a psychiatrist is different. A psychiatrist only prescribes medication. A psychologist is someone who works on therapy. A psychiatrist will not help you with your issues. He will just see your diagnosis, your symptoms, like you can't sleep, you're overthinking, you're hallucinating, and he's going to prescribe you medication. A therapist is the one who's actually going to help you with the thoughts, because when you take medication, symptoms reduce. Medication stops, the problem stands like a bully. So we have to address the thought process, which the therapist will help you with.
So how do I know I need to go to a psychiatrist or psychologist? How do I know
So,
that initially?
yes. So, firstly, it's very important to go to a psychologist. Seeing your
Okay.
symptoms, she will guide you whether you just need therapy or first you need medication. If you need medication, it can be two-way also, medication and therapy, or first medication, you are equipped to listen, to assimilate information or to process, and then enter into therapy. And like I said, your micronutrients and everything need to be in check. So the therapist will ask you for various blood tests, because a therapist cannot prescribe medicines that a doctor can do. Therefore, the therapist and the psychiatrist work hand in hand with each other.
Okay.
A clinical
Thank you.
diagnosis would need a psychiatrist for just diagnosis and medication. Rest, the therapist will help you.
Yes, Rita ma'am, you raised your hand. Neeta ma'am.
I think she's muted.
Anybody else?
No. I don't know, she is maybe silent. She is muted, in fact.
So she mentions, Lois, I was actually clapping. It's not a question. It's a kind of
Okay,
clap.
okay.
Okay, let's all clap for her, for Palka, for an excellent session we had.
Yes.
I'd like to thank all of you who've taken out this time from your busy schedule, all the people who are attending this program who've taken out time from their busy schedule to attend this program. So, thank you for being a part of it. And if you know someone who needs help, or if you need help, you can reach out to us at our platform. You can DM us, you can WhatsApp us. Help is available. It could be any issue. It could be any issue. Help is available. Come and address it. Address it, because happiness is your birthright. You need to be happy, and people around you need to be happy. And there is no issue that cannot be addressed. Every problem has a solution.
True.
So it's for us to address that we have a problem and then be open about it in addressing that.
Good. So thank you very much, Palka ma'am. Really, you've taken a lot of time in explaining, and it's